Hi, my name is Catherine Justice. I'm an RN to BSN student at Mizzou. We are going to be doing the first part of our head-to-toe assessment for nursing assessment and pathology. This is my patient, Abby. To begin, I'm going to wash my hands for the patient. I'm going to ask her name and date of birth.
Abby Hutchison, 7/18/87.
All right. What are we doing here today, Abby?
Just a wellness checkup.
Okay, and where are we at?
We are in the doctor's office.
All right. This just assess, one, that I have the correct patient, and two, just Abby's overall orientation and alertness level. We're going to, while I'm doing this, I just make sure that assess Abby's affect, look at her facial symmetry, overall cognitive function, making sure that she's able to stay on track with what I'm asking. I don't have to redirect her in any way. Next, I'm going to inspect her overall facial and head appearance, make sure there's no swelling, that it's in proportion to her body, that there's no drooping, there's no lesions on her face or her skin, noting that there's no drainage from her eyes, ears, or her nose, and that her mucous membranes of her mouth are moist and dry. I'm also going to be looking at her hair, make sure there's no parasites, dandruff, that it's hydrated, normal texture. I'm going to go ahead and palpate that. So I note any lumps or and areas of tenderness, which is all normal. Next, we're going to inspect Abby's neck. I'm going to be looking for any edema here in the throat, any skin folds, any abnormal masses that I can just quickly view with my eye. I'm also going to assess Abby for jugular vein distension. I would have her lay back and elevate her head to about a 45-degree angle, and then have her turn from side to side and note any distension there in her jugular veins. I'd also go ahead and palpate her carotid arteries. I would do one at a time, as not to put pressure on both of them at the same time. So I'm going to go ahead and do that now. Okay. Very good. Both strong, equal, palpable. Next, we're going to go ahead and palpate her lymph nodes. Going to just use light palpation, note any abnormalities, any notable masses. If I did feel any or any tenderness, I would note the location and size of them. So I'll go ahead and do that now. Just using light palpation here. Have patients tell me if any of them hurt. All right, very good. Okay, all normal. Next, we're going to go ahead and just inspect her trachea. Make sure that it's midline. Her body, have her look up. Swallow for me. Very good, normal swallow. Let me go ahead and palpate her thyroid gland. Have the patient flex their neck forward. Very good. Turn to the right a little bit. There we go. I'm going to put pressure on here with my left hand and feel with my right. Okay, looking for any abnormalities, none noted. I'm going to look to the left and do the same thing, placing pressure with the right hand and inspecting with the left. Okay, very good. So I should not be able to feel any masses there, but if I did, I would note the location and size. Ask Abby if she's had any problems swallowing recently. Been okay to swallow?
I have no habit.
Okay, good. So next we're going to inspect her nose. I'm going to look at the outward appearance of it. No redness, no drainage, like I said earlier. Make sure that the bridge of her nose is midline. I'm going to go ahead and palpate her sinuses here on her face. Have her tell me if any of them hurt or tender while palpating. No? Nope, okay. Also noting any crepiness there in her face. Going to next inspect the internal structure of her nose using my pen light. Okay, if you'll look up for me, Abby, all right? This is going to show if she has any drainage in there, make sure it's dark pink, note any blood, location of her septum, see if it's deviated or not. I'm going to move on to her mouth. I'm going to inspect her pharynx, thank you. We're also going to check her gag reflex while we're doing that. And I'm going to use a tongue blade and my pin light to do so. All right. Okay. Stick your tongue out and say ah for me. Ah. Okay. Gag is present. Tonsils are not swollen. They're pink, not red. There's no lesions, no drainage down the back of her throat. I didn't notice any type of infection on her tongue, any lesions such as thrush. All of her teeth are intact. She has good dental hygiene. We're going to move on to the cranial nerves. I'm going to start with her olfactory nerve. I'm going to have her first, I'm going to assess the patency of her nose. Have her push on each nair and inhale for me. Okay? Very good. Both are patent. So now we can take a cotton ball on there with some alcohol, and I'm going to have her occlude one side and see if she can smell with the cotton ball. Okay. You smell that?
Mm-hmm.
Okay. Same side. All right. Perfect. So both sides, she's able to smell. That nerve's intact. We're going to assess the optic nerve now. We're going to do this through the confrontation peripheral assessment. This is going to be, I'm going to use my 2 fingers here, and I'm going to have her follow them for me. Okay, very good. So she's able to move her eyes in all 6 directions. She has no nystagmus. That actually assesses the oculomotor, trochlear, and abductens nerve. To assess the optic nerve, we're going to do the peripheral confrontation, and that is placing one hand over the eye and assessing her peripheral vision. So, all right, Abby, go ahead and put your hand on that eye, and I'm going to bring my fingers around here. You tell me when you can see them.
Yeah.
Okay, look straight at me. Tell me when you can see them.
Yeah.
Okay.
Yeah.
Okay.
Yeah.
Okay, very good. Now do the other eye. Okay. So tell me when you can see them.
Yes.
Okay.
Yeah.
Okay.
Yeah.
Very good. All right. So peripheral nerve, peripheral is intact. We're going to assess her facial nerve now. Do this through having her move her muscles in a series of movements. So I'm going to have you raise your eyebrows for me. All right. Now close your eyes shut tight. Very good. Now smile real big. Puff out your cheeks. Very good. Okay, so her face moves bilaterally, symmetrical, no drooping noted, able to move her forehead muscles. We're going to assess her trigeminal nerve. We'll do this through the use of a cotton ball and a sharp object, not too sharp. Mm-hmm. So, now we close your eyes. I want you to tell me if you feel light or sharp.
Okay. Light.
Okay.
Sharp.
Okay.
Light.
Okay.
Light.
Well, it's kind of light, but it was
sharp.
So,
okay.
She's able to feel both soft and sharp pressure on the 3 areas of her face. Next, we're going to attest her acoustic nerve. We can do this through the use of a whisper test. I'm going to rub my fingers on each side and see if she's able to hear them just fine.
Mm-hmm.
Okay.
Yep.
Okay, very good. So she's able to hear a normal voice. She understands what I'm saying, and also the lightness of my fingertips. So next we're going to do the spinal accessory muscles. I'm going to apply pressure to each side of her face, having her turn her head against resistance in her shoulder. Right, so I'm going to have you look that direction. Very good. Strong. Okay, very good. I'm going to have her raise your shoulders, and I'm going to put pressure, and don't let me push her down. Okay, great. So both sides of her shoulders and her face. Facial muscles are strong and they work the same on both sides. We were able to assess the vagus and glossopharyngeal nerve when I did her gag reflex. It's intact. I'm also going to have her look up for me and swallow. Right, so swallow's intact. And last, we're going to do the hypoglossal muscle or nerve. I'm going to have her say a few words to assess her tongue movement. You can say tight, light, and dynamite.
Tight, light, dynamite.
Very good. And have you stick your tongue out for me and have you move from side to side. All right. So his full range of motion of her tongue, articulates well. No abnormalities noted for that.